My name is Mark Beckner. I am a spine surgeon who practices in Orlando, Florida at the Jewett Orthopedic Clinic. When I talk with a patient about whether to do a fusion or an arthroplasty, I will give them information on it because many patients nowadays want to research this on their own. And then at the next visit or at some point when we actually start making a decision, yes, we are going to do a surgery, then I will give them my advice and say, I think you are a good candidate for this procedure and here are the reasons why. You can point them to studies that do show, and at least in multi-levels, 2 levels, superiority, and I will talk to them about things like how it mimics the instantaneous axis rotation of the cervical spine, and they can understand that. The idea that if you fuse the spine, you put extra stresses on levels above or below, and that may result in surgery necessary later, and that you will retain motion that you would otherwise not have, or that you'll be able to return to activities more rapidly. I think the Mobi-C has a lot of the things that we're looking for in terms of mimicking disc motion. It certainly has a long track record of usage throughout the world, even though it's only recently been approved in the United States. So it's not a new device. It's not like it just came out, so there is a track record with it. I think if you look at the biomechanics of it, if you look at the materials that are used, these are things that have withstood the test of time. I think that as a orthopedist who is very much concerned about function of the human body, you can say we are restoring function rather than limiting function, which is something we've always interested in as much as possible, mimicking and restoring the human body to as close to its natural state as possible. And so a disc arthroplasty does that much better than a fusion. I think it's rare that you can make a superiority claim. Most of them are equivalency non-inferiority studies, which says, yes, you can say it is just as good as the other procedure. You can talk to surgeons, and when you're discussing with them a 2-level procedure, fusion versus arthroplasty, and they can say, I have great results with a 2-level fusion, you can say you will get superior results with a 2-level arthroplasty in the properly selected patients, and this study proves that. The gentleman who came to me, he's a police officer in agony, large disc herniation, radicular pain down the arm, couldn't sleep. It was interesting in that he had had a disc herniation on the opposite side about 1.5 years ago and had chosen to live with it and continued to have some symptoms but did get better. For some reason he herniated even more to the opposite side, which is rather unusual. But his pain was so much more this time. He was just in severe agony. He had the surgery, woke up. I could have done him as an outpatient, but we let him stay overnight. He came back to see me 5 days later and wanted to go back to work. There are even billboards up in our area, so they are coming and asking about disc arthroplasty versus disc fusion. So you have to educate them about, are you a candidate or not, because everybody that's a candidate for surgery is not necessarily a candidate for an arthroplasty, but the patients are definitely looking for this procedure and aware of it. Without reservation, I will recommend it to them. If they meet the criteria that are out there for patients who are good candidates for a cervical arthroplasty, this is what I recommend.